Now, one critical component in ensuring that these stories are not repeated is quantifying them. And today we are spotlighting groundbreaking research that does exactly that by Johns Hopkins University, the #1 public health university in the world. The International Injury Research Unit has been a very long time leader in injury prevention. So I'd like to extend a very warm thank you and welcome to Professor Abdul Bashani, Director of the International Injury Research Unit, and Professor Qingfeng Li, the lead author as well on the research to unpack the numbers of this important study.
Thank you, Natalie, and really an honor to be here with everyone to look at these numbers and really for the first time show the impact that the work you all are doing is having on what actually matters, that is lives saved and serious injuries averted. So if we can go to the next slides. Yeah. So this slide is titled The Reality, but really this is the story, right? We all use roads. Each and every one of us uses roads. Children use roads to get to school. We use roads to get to work. We use roads to run errands. But for a long time, we've just not paid attention to how these roads are designed to ensure our safety. And with the introduction of IRAP methodologies and IRAP tools, there was an opportunity to assess these roads and make them safer for everyone. And thanks to the work that everyone on this webinar and whoever has been involved has been doing. We know that safer infrastructure plays a very key role in the safe systems approach, and that we need to design our infrastructure so that we're eliminating or reducing risks for all road users, that we can enhance accessibility, including for people with disabilities, to prevent further risks to them, as well as facilitate, transfers from one transport mode to another. We all talk about modal shifts. We all talk about roads for everyone. So we really need to pay attention to each and every mode of transport and make sure that our systems are designed to accommodate that and accommodate it safely. So we're really pleased to be a very small part of this story. Clearly, we do need to show impact, and hopefully the numbers that we're presenting today will be used to generate more momentum and more action on the ground. As we've already heard, the IRAP partnership extends to more than 125 countries, with 3.6 million kilometers of roads have been assessed, and IRAP has influenced over $100 billion of road investment. But we know more can be done and more should be done, and therefore the objective for this study was really to understand the numbers behind the story. I know we titled this webinar saying the story behind the numbers, but it's really the numbers behind the stories that we're hearing. The story that, for example, Dr. Rim just shared, and putting some objectivity behind it and making sure country governments, leaders, politicians, etc., understand that these methodologies are having an impact, and that if they do implement them, that they will see tangible results. So we looked at the global coverage. Our study was based on over 400,000 kilometers of assessed roads from 1,039 projects in 74 countries. We looked retrospectively since 2016, and then prospectively projected lives and serious injuries saved over the lifetime of these countermeasures. And with that, I'm going to hand it over to my colleague, Dr. Qingfeng Li, to really talk about the numbers, the methodology, and highlight some of those details.
Yeah, sure. Thanks, Abdul. Can we go to the next slide? Yeah, sure. This flowchart shows the protocol for IRAP. So as you can see on the left, they first inspect the road, survey the road, collect information before and then pull that information into their software to do the star rating and many other reporting. And based on those assessments, they recommend specific intervention countermeasure to a stakeholder in the city, in the country, and then they implement that together with the stakeholders. After this, actually, they resurvey the road. They update their assessments. Then based on those pre and post, we do the estimation. Next one, please. And then here is our methodology. So as I mentioned, IRAP protocol specified before and after study design. Before the implementation, they inspect the road and code the data and rate the safety, and particularly for each type of road user. And then that's the assessment is summarized into FSI. And then based on that, they recommend network-wide countermeasure. After that, they update the survey. And then for, as you may know, they have a global coverage, and data collection are pretty different on different sites, different project. And then we did the estimate for some of the project, and then we apply the estimates to country and project specific data site calibrated through the software. Next one. So this map shows the global coverage of IRAP, and then particularly those projects. And used in this study, you can see IRAP really have a global coverage that cover North America, Latin America, Asia, Africa, and Europe, and many countries around the world. And then that's also the color shows different level of life and serious injury saved. Next one, please. Here are the key findings in addition to the 700,000 number you already heard. So actually, currently, IRAP protocol are saving about 160,000 per year. As you can see, their saving has been actually been accelerating over time, right? Currently saving more than the average number, and then going forward, and then they may save even more. And then so by the lifetime of those countermeasure that are already being implemented, a total of 3.2 million would be saved by the lifetime. And then here are some quick notes, and then you can learn more about the technical detail in the paper, but here are just some quick notes to clarify some of the things. So for example, the tables are for each country, for each project, and then the project may not all happen at the same time. They have some sequential events, and also some of the project may have not started to have impact yet. That's why I see you will see an even further larger impact going forward. Next one. So here's our recommendation based on the finding, based on the understanding the result. Clearly indicate the great potential to prevent more deaths and serious injuries through more extensive use of the protocol, particularly in low and middle income countries. You remember from the map, IRAP already have a global coverage, but many part of that global map is missing. Particularly, for example, you can see in African countries where we know, right, those low and middle income countries account for majority of the road traffic deaths and injuries. So you can see if we are the global community can apply those protocol to more broadly to Africa and many other countries, we will see more lives saved. And then we also recommend improving safety conscious planning, design, construction, and renovation. And based on like I just mentioned, our current estimates need some assumption, but in the future we recommend more comprehensive data collection and more technological support in the work. So I think that is our presentation for now. So James is also on the call. Do have anything to add?
Yes, I'd like to say a really big thank you to both Abdul and Qingfeng for the pioneering research that you've done here. I think it's a really important first step in estimating the impact of IRAP partners around the world making on addressing the burden of road safety injuries. Of course, this is only the first chapter of the story. as the research is based on a sample of 440,000 kilometers of data across 74 countries that spans a period of 2016 up to 2020. But when you put it into the wider context of even just the star rating, which has been used across 1.8 million kilometers and 126 countries, there's so much more that we could be shining a light on and celebrating, and so much good work going on. And so it's with this in mind that I'd put my request out to all IRAP partners, just to remember that at the heart of this research, that it's based on before and after studies. And so I really want to encourage you all to actually, wherever it is possible, to carry out those before and after studies and let IRAP know about them. Because it's firstly, it's important to highlight and celebrate the success that people are having in addressing this massive issue we all face together. But of course, it's with these insights we'll be able to actually further refine the methodology within this research and actually help us understand the impact and how it's varying around the world, and extend this methodology much, much further. Thank you very much.
Thank you all so much for your leadership in this study, which plays a truly essential role in enabling IRAP and its partners to positively influence investments and continue to save lives on roads.